there's always an issue if there's a single provider, vendor, company that produces and delivers the compound. There's also I think, a planning mistake, insufficient forecast capability, whereby the demand was vastly underestimated, and sometimes I have the feeling the supply was calculated as the supply capability was matching their demand forecast, which is probably only a fraction of what is really needed in terms of patient care. And there's some numbers that we actually, Jeremy, I wrote about that before. Our expectations in how many patients per year would need this treatment, even if you limit it to the castrate-resistant population, it would be close to between 30 and 40,000 patients a year who are end-stage patients, and potentially most of them qualify for Pluvicto. I think the company predicted something like 4,000 patients. That's one thing. The other thing is the production sites. They have 3 production sites, but only one is FDA approved currently, and that's in Italy. And so if something happens there, there's no backup solution. So the way this has affected the rollout is that we can now not treat new patients. The patients who are on treatment can be treated. The waiting time for new patients is probably somewhere between 4 and 6 months until we can start new patients on treatment. And what we wrote in this little editorial was that once other companies provide similar targeted radiotherapy approaches, then the supply problem will probably cease to exist, and the problem will be solved. But it will take another year, probably, or 2, till other companies are really on the market. So I would think that the rollout was a disaster, and creates an enormous challenge for patients. You have a waiting list of many patients who call, and you call the patient, and then you tell them you have to wait another 4 to 6 months in a group that has a life expectancy just above maybe 6 months. You know what that means for the patients. So yeah, it was kind of perfect storm. We hope within a year it will get better and more robust. And when other companies get in, then I think the problem will be over.
For example, Splash, which was initiated by Point Biopharma. Now I think Lenteus will coordinate the clinical transition and the commercial use, but Point was leading the clinical trial and initiated the clinical trial. They have created a brand new state-of-the-art radiopharmaceutical production facility in Indianapolis. And their compound is Lutetium-177 PSMA-617, which is a similar compound. It's also a small molecule targeting PSMA, labeled also with Lutetium-177. It's just that they started their company with this manufacturing facility right away, state of the art. So, because in Indianapolis, they have some facility to ship it through the whole US with all the aircraft system, it is expected that they may have less delivering issue and production issue and everything sorted out. So that's one. Curium, which is leading the Eclipse trial, it also with Lutetium-177 PSMA-617, same molecule. There is no patent on this one, so they both basically are using the same molecule. Not sure about the manufacturing process, because the FDA also approve a manufacturing process. It's not only about the final molecule, but here it is the same molecule, but they will have different FDA approval. I don't know exactly about their manufacturing and delivering setup, but Curium is already a company that is already established. They have several commercial radiopharmaceutical already in place, and I'm sure they can build on this network to make it work.
I think it depends a little bit which isotope you're talking about. There's enough lutetium, so that's not a problem. If you think about actinium, which is a different isotope that is labeled to a targeted molecule, then supply will remain a big problem, I think, because the production is very complicated, very complex. If it comes to with regards to lutetium, you should be able to supply sufficient amounts to really meet the demand, and I think there's no fundamental problem. It's very doable, as Jérémie said before. It's very doable if the planning is right, and if several players are on the field. In fact, it's actually helpful for each company that the other companies, because the supply probably cannot be met by a single company with their capabilities or facilities. So the more competition is in there, the better it is. I also think it's always good for the price point, because competition in the end will reduce price on the market. So I think there are many positive aspects of bringing many different companies into the field. There are also several companies that have manufacturing sites that could serve as backups. That is then just a matter of contracting and getting them the FDA approval, and going the extra mile to have more sites that can produce the labeled compound and can deliver it.
There are some potential issues. I don't think they will be limiting, but these will have to be taken into account. So all the radiation safety with the radiation waste management, if you go to very high volume of patients, maybe as it is going, maybe we're going in that direction with prostate cancer patient population. Currently, the use of lutetium or iodine remains low because, it's confined to, again, low prevalence diseases and maybe in only limited number of countries. If you bring that to another scale, another level with very high volume of use of Lutetium-177, you may have a lot of, waste of Lutetium-177. One of the daughter elements is there is a long-lived radioisotope, which we call metastable. It's Lutetium-177 metastable, and this one decays very slowly. So it can be in the environment. It's usually in the water. And some people say that if we go to this, ascending curve of numbers of use of Lutetium-177, at some point it will create an ecological and a radiation safety concern in the waters based on the Lutetium-177 small percentage that decays into metastable Lutetium-77. So at least that's the sailing message of other companies trying to bring up other radionuclides, delivering also beta radiation for medical use, and they want to bring up other radionuclide than the one currently in use to increase the potential options of delivering molecular radiotherapy. So you have the waste management. Then you also have the way you get these radionuclides. Some are artificial, some are natural, and you have to wait that it decays from the father elements. So you can have limited quantity of the father elements. Some they are being created in reactor. You just press a button and you create as much as you want. So these are other factors to take into consideration into the radionuclide market.